Hello, this is Dr. D, and today we are going to talk about blood pressure. All right, we did cover a bit of blood pressure in the last presentation, but I was running out of time, so there is an overlap of this presentation between the previous one and this one. I do apologize for that. All right, so we are looking at the factors. All right, and this chart really narrows it down. So use this chart, draw this chart, learn this chart to help you understand and give you the big picture. All right, if blood volume increases, if there's retention of fluid, blood pressure will increase. So a good question to ask is if you lose blood, all right, you get your cut and you lose blood, then what will happen? Will the blood volume increase or decrease? Blood volume will obviously decrease, and therefore blood pressure will decrease. All right. Now here, if the heart rate increases or the stroke volume increases, this is easy. We've done this in the past. Blood pressure will increase. What about blood viscosity? If blood viscosity increases, if there's increase in cell density, then what happens, which is called polycythemia, then obviously the blood will become more viscous and blood pressure will increase. In that case, you'll have to take what? Blood thinners, right? If there's peripheral resistance, what is peripheral resistance? If there's more friction between the blood and blood vessels because of turbulence, okay, and turbulence is caused because of what? Plaque, right? So we talked about this, that here if there is a blood vessel here and there is plaque in here, will the turbulence increase or decrease? Increase, and as a result of which blood pressure will increase, right? If there's contraction of the arterioles, the blood volume will also increase in the arteries, and therefore what will happen? If there's increase in blood volume, blood pressure will increase. Keep these factors in mind. All right, so this is just an example of the blood pressure controlled by changes in the cardiac output and peripheral resistance. This is just giving you the big picture. So let's see the first one. If the cardiac output increases, blood pressure rises. We talked about that, yes? So there are baroreceptors. These are pressure receptors. Excuse me. Where are pressure receptors located? You have to know this. Carotid sinus, and therefore also in the aortic arch. So here there are these receptors, baroreceptors, pressure receptors located, and they are going to send the message immediately to the cardiac control center. Where is the cardiac control center? In the medulla oblongata. What is the problem? The problem is blood pressure rises. So you have the big controlling guy here, which is the control center, and this is the medulla oblongata. So these receptors are going to report to the medulla oblongata, and medulla oblongata is going to use now what? Parasympathetic, right? So it is going to send impulses to the heart, and it will inhibit the SA node. What's the SA node? The sinoatrial node is the pacemaker of the heart. So if this is inhibited, will the heart beat? The heart rate will go increase or decrease? The heart rate will decrease. And if the heart rate decreases, blood pressure will automatically come back to normal. All right, now here there's a peripheral resistance. There's too much of resistance in the periphery. So therefore what happens is blood pressure is rising. So obviously you are going to get this, you are going to find this out by the baroreceptors. They will send them to the vasomotor center control, and the vasomotor center is inhibited because what happens is the vasomotor is associated, so you know, right, with your motor muscles. So there's less frequent sympathetic impulses to the arterial walls, vasodilation of the arterioles, and in decreased peripheral resistance. You do not want peripheral resistance, and therefore blood pressure returns back to normal. All right. So now let's look at the chemoreceptors. Either case, baroreceptors or chemoreceptors are reporting to the control center, which is the medulla oblongata. Keep these in mind, okay? So the chemoreceptors, remember, they are going to monitor carbon dioxide, oxygen, and pH. Now, I do not know why I wrote pH again, because carbon dioxide will change your pH. So more carbon dioxide, higher the carbon dioxide, lower the pH. Hopefully you know this, right? More carbon dioxide means what? More acidic. More acidic means what? Lower pH. Of course. Where are these chemoreceptors located? Have to know this. Again, they're located near the carotid sinus, near the aortic arch, and they are located within the medulla oblongata and monitor the CFS, cerebrospinal fluid. Go back, think about 201. 201, what did you study? That the brain is a fluid-filled structure, right? And this fluid is the cerebrospinal fluid. So these sense cells or sensory cells are lining the cerebrospinal fluid. So any change in carbon dioxide will change the what? Acidity, and will make the cerebrospinal fluid more will have a lower pH. They will report these chemoreceptors will report to the what? Medulla oblongata. So increase in carbon dioxide, fall in the pH, decreased oxygen. These centers are stimulated, vasoacceleratory and vasomotor. So what will happen is you are going to increase cardiac output, right? You are going to increase cardiac output means what? So here you are going to circulate the blood faster, and you're going to push the blood through the what? The lungs. What is happening in the lungs? In the lungs, carbon dioxide is being released, oxygen is being taken in. Got it? So here we are going to actually study this more in the unit 4. So the respiratory center are stimulated to increase breathing rate to supply increased demand of oxygen. We know this, right? So I think with no, we don't. All right, so other factors is high sodium intake. What does high sodium do? Go back here. Go back to this slide. What does high sodium do? Remember, wherever sodium goes, water will follow. So those people who have take too much of sodium, blood will follow. That means the blood volume amount of your blood will increase. And if blood volume increases, blood pressure increases. This is the reason people who have high blood pressure are told to take in less sodium or to take salt which is very low on sodium. All right, which I think it's called the light salt, L-I-T-E salt. That's the name in the market. So here, this is what I was explaining is high sodium intake will result in high blood pressure, that is hypertension. Obesity. Why is obesity? What is obesity got to do? Obesity is going to increase what? Is going to narrow down your blood vessels, and therefore is going to increase what? Peripheral resistance. All right. So the first thing, if you have high blood pressure, the first thing the doctor is going to ask you is that you need to lose weight. Psychological stress. If there's psychological stress, you are going to produce more stress hormones, right? Adrenal hormones, thyroid hormones. And what does the epinephrine, norepinephrine, or the thyroid hormones T3, T4 do? They are going to increase what? Stroke volume. They are going to increase heart rate, right? So drugs to treat hypertension, how do they work? The first one is the ACE inhibitor. And so at this point, we absolutely need to talk about ACE. All right. What is ACE? So here, or this angiotensin pathway is, what happens is that whenever there is a decrease in blood pressure, so decrease in blood pressure is sensed by certain cells in the kidney. Then immediately what happens is it will stimulate the secretion of the enzyme renin. This enzyme renin is going to break down angiotensinogen to angiotensin 1. All right, I repeat. As soon as there's decrease in blood pressure or low sodium, this is sensed by certain cells, special cells in the kidney, and an enzyme called renin is produced, which will break down angiotensinogen or convert angiotensinogen into angiotensin 1. A second enzyme called ACE, angiotensin converting enzyme, converts angiotensin 1 into angiotensin 2. As soon as angiotensin 2 is produced, it will stimulate the adrenal cortex to produce aldosterone. Aldosterone is a hormone. So what does it do? it will act on the kidneys to conserve sodium. It will not allow the loss of sodium. What did I say about sodium? The minute you have more sodium in the body, water will follow. So you are not going to lose water via urine. So there will be, what will happen to the blood volume? If you conserve sodium, water will follow, blood volume will increase, and if blood volume increases, blood pressure will also increase. You have to know this pathway, which is called the RAS pathway. I'm writing this pathway. You have to know this. So people call it as the RAS pathway. This is renin, angiotensin, aldosterone system. Okay, renin is the enzyme, don't forget. Angiotensin is a product. There's angiotensin 1, angiotensin 2, and angiotensin 2 is going to stimulate formation or production or release of aldosterone, which is a hormone, by the adrenal glands. Okay, so here you have to know this RAS pathway, and as we progress, we are going to go more and more in detail of this RAS pathway. Every unit will cover the RAS pathway, so you might as well know it. So what are the drugs which are used to treat hypertension? Well, first is ACE inhibitors. Do you want this? So if you notice that if you block this enzyme, then will angiotensin 1 be converted into angiotensin 2? Answer is no. Because unless you don't have angiotensin, once you have angiotensin 2, you are going to produce aldosterone. If you block ACE, you do not allow the production of angiotensin 2, which will not stimulate the adrenal gland to produce aldosterone. And aldosterone will not conserve sodium. You lose sodium. And that's good. The more sodium you lose, the more water you lose. And the more water you lose, the blood volume will decrease, and therefore blood pressure will decrease. You have to know this, okay? Calcium channel blockers, have to know this. Calcium is going to increase the force and rate of heart. And if your heart rate is high, blood pressure will be high. If your output is high, a stroke volume is high, contractility is high, the output will be high. You know that, right? Diuretics, what do? They make you urinate more. Therefore, you're losing more and more of water and ions. Therefore, your blood volume is going down and your blood pressure is also going down. Finally, beta blockers. These are the ones that will inhibit the binding of epinephrine to norepinephrine. Because what do these hormones do? These hormones, they bind to the receptors on the cardiac muscles and will increase heart rate. You already have high blood pressure. Do you want to increase heart rate? Answer is no. So definitely you should understand that you have to know this before you start playing and understanding or getting the whole picture. Get it? So if there are questions or concerns, please contact me. And I thank you for listening to my presentation. With this, we come to the end of cardiovascular. More will follow in the trace or drop of blood. Have a good day. Thank you.